Groove pancreatitis is a rare form of chronic pancreatitis of the anatomic space known as groove between the dorsocranial part of the head of the pancreas, the duodenum, and the common bile duct. It is typical of 40 to 50 years old alcoholic men with a clinical presentation characterized by postprandial abdominal pain, vomiting, and weight loss. Groove pancreatitis can be divided into two forms. The segmental form that involves both a groove space and the head of the pancreas, and the pure form that affects only the groove. We present a case of a 24-year-old man with no comorbidities and with a history of chronic alcohol abuse. Hence is an active smoker of 20 cigarettes per day. In 2012, the patient had an episode of acute alcoholic edematous pancreatitis, which resolved following discontinuation of alcohol use. In 2015, with the reintroduction of alcohol use, he started to complain chronic abdominal pain, progressive weight loss, and fluctuation of pancreatic enzymes. Because of the persistence of symptoms, the patient underwent a CT scan that showed the hypodense area between stomach, head of the pancreas, and duodenal wall, with some well-delineated cysts inside and two tiny calcifications. An MRI confirmed the presence of a isointense area between the head of the pancreas and the duodenal wall with multiple tiny cysts inside. To better clarify the nature of these findings, the patient was scheduled for a US examination. From the second portion of duodenum, a cluster of multiple cystic lesions with regular margins can be seen adjacent to the upper part of the head of the pancreas. These cysts involve the duodenal muscularis propria and are located into the groove area between the duodenal wall and the posterior aspect of the head of the pancreas that maintains a normal echogenicity. Some tiny calcifications are visible in the peripheral aspect of the lesion. On the basis of the clinical history and of the morphological findings, the final diagnosis was consistent with the cystic variant of the pure type groove pancreatitis. In conclusion, we can say that groove pancreatitis is a rare form of chronic pancreatitis occurring mostly in alcoholic men. Cystic variant is a subtype of groove pancreatitis as opposed as the solid variant. Endoscopic ultrasound is an important tool for the diagnosis of chronic pancreatitis, even if US features of groove pancreatitis have not been extensively reported to date.